Photosensitivity is sensitivity to light. The light can emit certain wavelengths that can cause discomfort to the eyes. The nerves connect to the brain, and the brain interprets it in a way such that can trigger a migraine attack. Photosensitivity can happen before a migraine, during a migraine, or after a migraine. It's so common that it's actually part of the migraine diagnostic criteria. And in that sense, it's called photophobia. One of the more common treatments that we talk about in our offices as headache specialists is for individuals to wear certain sunglasses, appropriate sunglasses that filter certain wavelengths of light that are more likely to cause photosensitivity. When someone is looking into sunglasses to help treat photosensitivity, it's important that they speak to an eye care provider to make sure that they're well versed and aware of the certain particular tintings that are available for blocking certain wavelengths, and also choose certain frames that can help block light that comes from above, that comes from the side, and that causes glare that comes from the back. We want to make sure that the tinting involves a polarized type of tint that scatters light that helps decreases glare. One example of a tint that we use is the FL41 tint. That tint has been shown to be effective in helping with photosensitivity. There are a lot of individuals with migraine that experience photosensitivity indoors. And we see that because a lot of the lights that are used indoors, like fluorescent lights, computer screens, those wavelengths that come out of those lights can actually cause photosensitivity. So it's quite common. We do recommend that individuals who experience photosensitivity indoors use appropriate tinting glasses at times. And also, in terms of computer screens, there can be tinting and adjustments that can be done for that as well. I want to issue a word of caution for individuals who might want to wear sunglasses indoors. And if you do that a lot of the time, that can cause a phenomenon called chronic dark adaptation. Once you break out into the sunlight, the light that's coming onto your eyes is so bright that you just can't handle it and you're super sensitive to it. So we want to make sure that the individual wearing indoor sunglasses, one, has appropriate filtering that targets the photosensitivity, and two, takes breaks throughout the day from it in order to prevent the chronic dark adaptation. If someone is wearing the appropriate amount of filtering in their sunglasses and they're still really suffering from photosensitivity, especially in between attacks, I really want them to make an appointment to see a headache specialist, because there might be an issue that's not being addressed. Photosensitivity can be a hallmark of uncontrolled migraines. So we want to make sure that they have the right management on board that can supplement the sunglasses in order to decrease the photosensitivity much better.